My name is Aditi and I will be interviewing Ronald Reagan Medical Center volunteers. Our group believes participating in experiences like hospital volunteering have more of a balanced view on diseases, like DMD, due to their medical exposure and intimate patient interactions. We would like to tell a story of how volunteers gain unique insight, hence we will ask 10 questions on the psychological and medical aspects of DMD. Let's get started.
DMD?
D what?
DMD.
DMD.
Degenerative muscle disease.
DMD? I'm gonna assume that it's muscular dystrophy. It's Duchenne muscular dystrophy, and basically it's a medical condition that leads to muscle wasting. And first it affects like your skeletal muscles, but then progresses to like other ones. Eventually your heart muscle, which will cause death. And it's called Duchenne because it's named after the French neurologist. His last name was Duchenne.
Okay.
Wouldn't it be genetic?
No idea.
It is overuse of muscles.
Genetic mutation.
I don't think there's probably a cause, like an external cause, but it's probably something like your genetics.
There's a mutation in a gene that encodes for a protein called dystrophin. So basically that mutated version causes it to like not be expressed, and then the lack of dystrophin leads to all the muscle wasting and everything.
Okay.
Physical therapy.
Would they need like a specialized wheelchair, something that will help them breathe?
They probably need help from doctors who can like help them. Probably a lot of PT.
Probably you would need like a wheelchair if you're like, you couldn't walk. Like you might need to be put on like some sort of breathing thing.
I have to say to 60.
Adolescent, like 14 to 16, not sure.
15 or 20.
Under 40 maybe.
With our scientific advancement, we can go past 30s, but some people, like very few, can go past 40s or 50s. Okay.
Men.
Woman.
Maybe females.
Male.
Yes, you're correct. It's an X-linked recessive disorder, so it's going to mainly affect them, unless if the woman has something like Turner's disease and they already have like one X chromosome, they can also have it as well.
69.
Probably a majority of them.
I'm gonna guess and say 50%.
I'm guessing over 90.
Yeah, it's pretty high. Just in the age group for boys 5 to 9 years old, it's 3 and 10. I would probably say they wouldn't be more likely.
I'd say so, yeah.
No, I don't think they'd be more risk of mental health.
Actually, just for the eldest males in families with DMD, they report 4 out of 10 will have mental health issues.
No, I haven't.
No, I have not.
No.
I have gone around the hospital and seen people, but I haven't personally like interacted with them.
Oh yeah, I've definitely learned a lot about diseases, not necessarily muscular dystrophy, but other.
So I see like some like things that I usually like I've never seen before, like haven't heard of before. Honestly, not really.
Not really?
Not at all.
Not really.
Let's see. I just started today. So.
Oh wow.
Yeah, I didn't know anything. Now I know some things about it.
It clarified that there's a mental health aspect when you have like stuff that affects you like physiologically and affects you. So, yeah.
Yeah, I've definitely learned a lot in the last 3 minutes. Well, I feel like if 4 and 10 are also like affected mentally, then there should be like some sort of like, I don't know if it's like maybe depression or like counseling or something to help with that, to improve their quality of life while they're still alive.
I feel like they should have a lot more care and be given a lot of aid with, because you said a lot of them they're mentally disabled sometimes, so I feel like they need a lot of support in that aspect, so I feel like they could use all the help they could get.
Definitely more research and like more awareness about such diseases.
I guess societal, like I guess we should know more about it, because like I literally heard about it. I mean, I probably heard about it before, but like I never really like knew about it that well.
People need to be educated about it and then just be more accepting. We believe that the volunteers are more aware of the mental health components. Very few of the volunteers actually knew about the disease or learned about it before their volunteering program. However, many still valued the importance of awareness and believe that this is one of the most important things people should do for patients with DMD. Almost all of the volunteers had a different perspective after the interview, and it shows that they're more open-minded and are willing to learn more about the disease. Some of the volunteers actually acknowledged both the physical and mental disabilities for people with DMD, and they suggested that they would need both cognitive and physical therapy. Overall, I believe that volunteers definitely bring a unique perspective and that they acknowledge the importance of awareness and education, and that their discussions in the molecular and social aspects of DMD are more balanced.
First of all, I think we could start teaching it as part of the volunteering programs that our volunteers work in so that they have a better idea of the patients they might encounter. Next, I think we could start teaching it at school so that we learn about it at an earlier age and we're more aware about it. One combination that has worked before for raising awareness about a certain illness or disease is posting videos on social media and making challenges, like the ALS challenge, the Ice Bucket challenge, in which a lot of people, even celebrities, participated in, and they successfully raised millions of dollars doing that. If we had a video like that went viral but raised money and awareness for DMD, we would essentially be able, hopefully, to raise a lot of money for DMD as well.